277 patients were enrolled from around North America, and they were accrued in 2 years, which is a very rapid rate of accrual for a study like this. What we found is that the combination regimens were tolerated. There was no difference in fever and neutropenia between combination regimens and azacitidine alone. Patients who received lenalidomide were slightly more likely to have a rash. Patients who had received azacitidine and vorinostat were slightly more likely to have GI toxicities. What was concerning is that patients who received combination therapies were significantly more likely to have dose reductions that weren't specified by the protocol. So in other words, their physicians were unilaterally deciding to reduce those doses without checking how they should do it by the protocols. When we focused on overall response rate, those patients who received azacitidine and lenalidomide had an overall response rate of 49% compared to 38% for those patients who received azacitidine monotherapy. That was not a statistically significant difference with a p-value of 0.16. Those patients who received azacitidine and vorinostat actually had a lower overall response rate to those patients who received azacitidine monotherapy. However, in the subgroup of patients who had chronic myelomonocytic leukemia, the overall response rate for azacitidine and lenalidomide was 68% compared to 29% for azacitidine monotherapy, and that was a statistically significant difference. We also found that patients who received combination therapies, while this wasn't a primary endpoint, appeared to live 2 to 3 months longer than those patients who received azacitidine monotherapy. And once again, that was not a significant difference, and the study wasn't powered to look at overall survival. Our conclusions from this is that unfortunately there was no difference in overall response rate for either of the combination therapies versus azacitidine alone, with the exception of patients who had chronic myelomonocytic leukemia, and this may represent a good combination regimen to give to these patient subtypes.